Hi, this is going to be a hard auscultation exam or demonstration. Basically, what we're going to do is I'm going to go ahead and explain it on a pillow and then going to go ahead and do it on myself. So what we're going to need is going to be a stethoscope. Quick note on the stethoscope, make sure that the pointy earbud, whatever you're going to call it, is facing forward, matches your ear canal. So put it like this, not like that. Awesome. Next, we're gonna go ahead and grab our mannequin, which in this case is gonna be this lovely pillow. We're gonna tell our patient, hey, this is gonna be a hard auscultation exam. We're gonna need to basically touch you. It's gonna be a skin on skin. So if it's a female, we always want them to shield this way, and whenever we go to the mitral point, they go up, okay? If it's a male, not necessarily. But just keep in mind that they tell them that they can if they want, if they feel like they need to. So starting on the sternal angle, we're gonna go ahead and palpate the sternal angle and then go this way. That's gonna give us our first auscultation point, which is gonna be the aortic. We're gonna move to the other side of the sternal angle. It's gonna be the pulmonic. Then on the third intercostal space is gonna be the herbs. Then between the between the fourth and fifth, we're gonna have our tricuspid, so fourth intercostal, and then fifth intercostal, and then mid-clavicular, we're gonna have our mitral. I know it's kind of hard to see on a pillow. The other thing that we're gonna do is when we start actually auscultating, aka when we have our stethoscope on, we're gonna be palpating the carotid artery, which is gonna be at the level of the coracoid cartilage. So put it on, and then you start auscultating all 6 spots with both the bell and the diaphragm. The diaphragm is gonna be for low pitch, bell is gonna be for high pitch. We're gonna go ahead and do both sides again with each one of them. So let's move on myself. Okay, sorry for whoever's watching this. I should work out more. Anyways, go ahead and palpate carotid, sternal, and then go. Keep in mind that we have to be 3 to 5 seconds on each one of the spots. Okay. This will be herbs point, again, third intercostal space. Then tricuspid, which is going to be fourth. And then again, tricuspid on the fifth intercostal space. And the last is going to be the mitral. Now that we have finished auscultating with the bell, with the diaphragm, we're going to go ahead and flip it to the bell for high pitch. Okay, awesome. Now that we have palpating all 6 spots with both diaphragm and belt, that will conclude our exam. Thank you very much.